Okay, before entering the patient's room, I went ahead and checked the patient's chart and then went ahead and gathered my supplies. And today we're going to do some nasal suctioning. So I went ahead and grabbed some different size of nasal trumpets, some and a couple of sterile catheter suctioning trays. Nasal suctioning is a sterile procedure, so we need to make sure that we have all of our supplies before we go in the room. I'm also going to go ahead and grab a suction canister just in case it's not set up in the room. Then I'll go ahead and enter the patient's room. Upon entering, I'm going to knock on the door, wait for permission to come in, introduce myself. Hi, Mrs. Smith. My name's Kate. I'm from the respiratory care team here at the hospital. It looks like you're having a hard time breathing today, so the doctor had some nasal suctioning set up for you, okay? Do you mind if I go ahead and listen to some breath sounds? Sure. So I'm going to go ahead and wash my hands, put on some gloves, and assess my patient. I'll check for vitals, respiratory rate, or SpO2. Have her take some deep breaths and listen to her lung sounds. I can hear that upon listening that she has a lot of mucus that she's having trouble clearing. I'll ask my patient, Mrs. Smith, can you go ahead and give me a cough? Very weak, non-productive cough, but there's clearly a lot of phlegm and mucus inside of her airways. So I'm going to go ahead and see, Mrs. Smith, what size nasal trumpet I need for you here today. So as you can see, this one, from the nair all the way to the ear tip, it goes past it. It's a little bit too long. So we're going to go ahead and try this one, measure. It looks great, good size. So we have our nasal trumpet. And we have our sterile catheter tray. I have suction set up to negative 120. For an adult, you want it from negative 120 to negative 150. So now I'm going to go ahead and put on or open up my sterile procedure here. So Mrs. Smith, just so you know, I just need this nasal trumpet that I just measured here. It needs to go into your nose here, into your nair. I'm going to insert it with some lubrication, insert it, and then we're going to go ahead and insert a little catheter and suction some of that mucus out, okay? Okay, so I went ahead and explained to the patient, opened up my tray. First thing I'll see is some gloves. I'll go ahead and put my gloves on. My left hand is going to be my clean hand, and I'll make sure that I'm holding the gloves correctly, but my right hand is going to be sterile hand here. Okay, I'm going to go ahead and, Mrs. Smith, I'm going to give you some oxygen here before we do the procedure, okay? And with my sterile hand, I'll go ahead and grab the catheter. I'm going to put some sterile saline into the tray here, hook up my catheter to the wall, to the suction, and we'll go ahead and test, hold the thumb port, see if it's suctioning. It looks great, nice and clear. So, and I have some lubrication on my gloves that I went ahead and put on. So now we're ready to suction. No, we're not ready to suction. Let me put that back into the tray. I'm going to put your nasal trumpet in. So we have your nasal trumpet here. Make sure that it's lubricated. You always want the bevel facing towards the septum. If you feel any resistance, too much resistance going in, she might have a deviated septum, so we'll try the other side of her nose here. So on the count of 3, Mrs. Smith, go ahead and take a deep breath in. 1, 2, 3, and we want to insert quickly and as smooth as possible. So now I'm going to give her a little bit more oxygen because that was kind of harsh on Mrs. Smith. Now I can go ahead and grab my catheter. Move up the catheter a little bit. All right, Mrs. Smith, on the count of 3, we're going to go ahead and insert. 1, 2, 3, and I'm feeding it through pretty quickly. We want to take no longer than 15 seconds for the whole thing. I feel some resistance. Pull back a little bit, pull down the thumb port, and slowly suction it out. Again, taking no longer than 15 seconds. Put this back into my sterile tray, just in case we need to do it again, and give Mrs. Smith some oxygen Just take some slow breaths for me. I'm going to be monitoring her SpO2, respiratory rate, heart rate, and make sure that the patient tolerated the procedure okay. All right, can you go ahead and give me a cough, Mrs. Smith? We're going to go ahead and let you recover for a little bit. We'll come back in a little while and go ahead and try suctioning you again. We're going to leave this nasal trumpet in. The more I have to put it in and out, taking it in and out, it can cause a lot of trauma inside your nose here. So if we just leave it in, I know it's rather uncomfortable, but hopefully next time I come around to suction, we possibly could take it out, okay? All right, I'll make sure that the patient is comfortable, that she has, or I'll go ahead and gather all my stuff, throw it away, clean up, make sure the bed is low, locked, so she has her call light, and